Pneumoparotitis characterized by the presence of air within the parotid gland due to reflex of pressured air from the mouth into the parotid duct. The swelling may be unilateral or bilateral, tender or non-tender. There may be crepitus or frothy saliva, and air bubbles may produce on massage or pressure on the parotid gland. That froth and air bubbles coming from the parotid duct is the diagnostic of pneumoparotitis. Rarely, air may escape from the parotid gland, giving rise to subcutaneous emphysema of the face and neck, sometimes leading to mediastinum and possible in the extent into the pneumothorax. Pneumoparotitis is most likely in people where raised intraoral pressure is common, like wind instrument players, balloons, glass blowers, bicycle tire inflator, dental procedures, where power instruments are used for the oral suction, and it is also common in COPD cases. Sometimes common in whistling, cystic fibrosis cases, and patient who use their nose blowing and more doing the Valsalva maneuver. Occasionally, pneumoparotitis may self-induce, reflecting the mental illness, and there has been report pneumoparotitis due to spirometry also. In most instances, there is no associated infection like suppurative sialoadenitis or chronic sialoadenitis, but there are maybe infection chances of infection also there in this pneumoparotitis. In most of the cases, clinical history is sufficient and there is no need for detailed investigation in these pneumoparotitis cases. So history, and sometime you minimally do X-ray of this area, you will get the diagnosis. On X-ray neck, you can see there is subcutaneous emphysema or air bubble in the parotid region is correlation with history diagnostic of pneumoparotitis. On ultrasonography, there is hyperechoic area with posterior shadowing. In this picture, you can see arrowhead showing the hyperechoic air in the parotid, and there is posterior shadowing of USG. The diagnosis of choice is CT scan. You can see pneumoparotid gland, or there is air bubble in the parotid gland, and you can see the extension of this subcutaneous emphysema also. In pneumoparotitis, treatment is only symptomatic treatment and cessation of factor causing the increased intraoral pressure.